In this video, we are going to be reading from the Menopause Guidebook. It is the ninth edition and it comes from the North American Menopause Society. Hello, everyone. Thank you for joining Adult CSL Online Learning. I'm Dr. Hernandez Smith. Before we begin, we want to thank our subscribers for supporting this channel. I'm going through this stage of life and it is very confusing. And I thought reading this information not only would be helpful for myself, but maybe for other people, such as my subscribers. If you're interested in purchasing your own copy of this guidebook, the Menopause Guidebook, ninth edition, you can order it at www.menopause.org. Chapter 1, An Introduction to Menopause. What is menopause? A new era, menopause terms, frequently asked questions. Chapter 1, An Introduction to Menopause. If you're approaching the age of menopause, you may be unsure or even a little fearful of what to expect. The idea of menopause has long held negative connotations in our society, largely tied to stigma of aging. But it's a normal and natural part of a woman's life and a period of life that can be just as well lived as earlier stages. What is menopause? In general, the word menopause refers to the time when a woman is no longer able to naturally bear children. And in women with a uterus and ovaries, this is usually marked by the day of the final menstrual period, FMP. Because the date of the last period is only considered official when an entire year has passed without any menstrual bleeding, most women don't know that they've reached menopause until some time has passed. Menopause occurs normally in a woman aged between 40 and 58 years, although some women may experience natural menopause as early as in their 30s or as late as in their 60s. Much like the timing of puberty, it's common for women to reach menopause at a point similar to that of their mothers and sisters. Smoking has shown to advance the start of menopause by about 2 years. However, other factors, age at first period, and the use of hormone contraceptives or fertility treatments don't appear to affect menopause's onset. Natural versus induced causes. Menopause that occurs naturally happens because of the loss of egg cells, follicles, that occurs over time. The decline in follicles causes a drop in estrogen, primary female sex hormone. When ovaries run out of follicles with menopause, estrogen levels drop to where they were before puberty, and menstrual bleeding stops. For some women, menopause may occur earlier because of medical reasons. The surgical removal of both ovaries brings about immediate menopause. Chemotherapy and pelvic radiation therapy for cancer also may cause enough damage to the ovaries to trigger menopause. For other women, certain medical conditions may cause disruptions of hormone levels and cause menopause symptoms at very early stages. Changes over time. In the years leading up to menopause, a woman may start to notice changes that signal the approach of the menopause transition, commonly in her 40s. Changes in the timing or pattern of menstrual periods, such as a varying cycle length or a menstrual flow that's lighter or heavier than normal, are often the first sign. Initially, your cycle may shift a few days longer or shorter. As menopause approaches, cycles may vary by a week or more in one direction or another, but in general, cycles move further apart. This marks a stage known as perimenopause. As hormone levels continue to fluctuate, your body may eventually skip an entire cycle or even several cycles. until menopause is reached and menstrual bleeding has stopped entirely. The spectrum of symptoms. During this time, you may begin to notice symptoms of menopause that include hot flashes and night sweats, sleep challenges, vaginal dryness, and often urinary frequency or urgency. These symptoms often begin years before menopause itself occurs and can last for years after menopause has been reached. There's a wide spectrum of how women experience symptoms of menopause. On one end are women who have no noticeable symptoms other than their menstrual periods stopping. On the other end are women with severe symptoms that include irregular periods, raging hot flashes, sleep disturbances, mood changes, and vaginal dryness to the point of pain with sexual activity. Most women fall between these two extremes, and the ease, difficulty, or duration of their symptoms cannot be predicted. A new era. A number of other physical changes may begin to occur as you go through and beyond menopause as a part of normal aging. Conditions that can occur because of aging include weight gain, hypertension, diabetes, thyroid disorders, and sleep apnea. With age also comes an increase of heart disease, osteoporosis, and many types of cancer. As you enter into the menopause transition, it's wise to take a look at your lifestyle and any genetic or predisposed risk factors you may have for these conditions. Making healthy lifestyle changes now, including those related to your diet, physical activity, use of tobacco, and alcohol, and stress levels, may help limit your risk and allow you to better manage changes that do occur. Menopause can be an emotional time because it signals a new era of life. Some women may embrace the freedom that comes with the end of their reproductive years and concerns about birth control and unplanned pregnancies. Others may be saddened at the passing of their childbearing years. Many of the changes that come with menopause and aging aren't avoidable, but how you experience menopause and the years follow has much to do with your attitude. Far from being the end of life, you may find menopause to be a new beginning, one that can be lived richly, fully, and in good overall health. Knowing the spectrum of what a normal experience may help to ease your concerns and help you to prepare for what's to come. Frequently asked questions. How will I know when I've reached menopause? You're considered to have reached menopause once you've had your FMP. However, in the same time leading up to menopause, it's common for women to skip one or more cycles as their hormone levels decline, making it difficult to know for certain when a period is the last. For that reason, menopause isn't considered official until you've gone 12 months without menstrual bleeding. It's uncommon for women to start having periods again after not having them for 12 months. If you've been told you've reached menopause but begin to experience vaginal bleeding at a later time, it's important to be evaluated by your healthcare provider. If my periods are fluctuating, should I have my hormone levels tested? During the menopause transition, hormone levels change drastically throughout a menstrual cycle. For that reason, hormone tests to determine your menopause status are not usually helpful, but in some situations, testing may be recommended to check specific hormone levels. These situations include when there are fertility issues or when a woman's periods stop at an age outside the range of typical menopause. Testing also may be done in a woman who's had her uterus removed, hysterectomy, but still retains one or more ovaries, because a lack of menstrual periods can make menopause status difficult to determine. Similarly, if a woman is taking hormone contraceptives, this may mask symptoms of menopause, including changes in menstrual periods. In these cases, testing can help a woman make decisions about beginning or adjusting treatment. For women taking hormone contraception, testing should occur when she is at least 7 days without hormones. If testing is done, it often involves a measurement of follicle stimulating hormone, FSH levels. As the woman approaches menopause, the blood level of this hormone tends to increase. When a woman's FSH level is above 30 ml and her periods have stopped for a year, it's generally accepted that she has reached menopause. However, a single FSH measurement can be misleading in perimenopause because estrogen and FSH levels can vary greatly during this time. In addition, a lower FSH level in a woman having changing periods and other menopause symptoms does not eliminate the likelihood that she's in premenopause. FSH tests are not valid for women using hormone therapies, such as birth control pills. Although over the counter tests are available to measure FSH, they're expensive and tend not to be very informative. Other testing, such as a saliva test to check hormone levels, may be recommended. However, these are not considered accurate and should not be used to evaluate menopause symptoms. There's no simple test to predict or confirm menopause or perimenopause, but research continues. If you're having symptoms of menopause or unsure of your menopause status, it's a good time to have a complete medical examination by a healthcare professional. When can I stop using contraception? Even when menstrual cycles are irregular, women in perimenopause can still get pregnant. For women who don't want more children, it's advisable to use a form of birth control until menopause is confirmed at 1 year after the FMP. Keep in mind that barrier protection, such as with a condom, is still crucial at all ages when engaging in sexual activity with a new or non monogamous partner to reduce the risk of sexually transmitted infections. These are menopause terms. Menopause terms. The terminology related to menopause can be confusing at times. Here are some common terms for you to understand. Menopause marks the end of natural reproduction. Officially, menopause is the FMP for a woman with a uterus and one or both ovaries. In surgical or induced menopause, it's the time when both ovaries are removed or damaged. Natural menopause is menopause that occurs as part of a woman's life and is not caused by any medical treatment. Menopause is considered official when the FMP is followed by 12 months of no periods. Surgical menopause or induced menopause is menopause caused by removal of both ovaries or damage to both ovaries by chemotherapy or radiation, for example. Premature menopause is menopause that occurs before age 40. Perimenopause, meaning around menopause, includes the span of time, usually several years before natural menopause, when menopause periods become irregular by 1 or more weeks. It also includes the 1 year after the FMP. The menopause transition includes the time when the menstrual period intervals vary by 1 or more weeks up to until FMP. Much of this time overlaps with perimenopause and is marked by fluctuations in estrogen levels. Postmenopause is the rest of life after FMP. The next video in this series will be about premature menopause, Chapter 2. Thank you so much, and I'll see you in the next one. Have a great day.